Do you frequently feel like your heart aches sometimes? Or maybe you've been so tired that even sleeping 10 hours doesn't help. What if I told you it's not just stress or laziness? One possible reason could be infectious mononucleosis, often called mono or the kissing disease. It mainly affects teens and young adults. Imagine you're back from spring break and feel completely wiped out. Your throat hurts badly, you're feverish, and your neck feels stiff because your glands are swollen. That's mono waving hello. It's common and usually not dangerous, but it sure can slow you down for weeks. Ever been so drained that even texting feels like a workout? Yeah, that's mono style. So what actually causes mono? Think of it like a sneaky virus moving in without knocking. The main culprit is the Epstein-Barr virus, EBV. It's part of the herpes virus family, yes, like cold sores but different. How does it spread? Through saliva. So, sharing a drink, kissing someone who's infected, or even using their toothbrush can pass it on. Picture this: you grab your friend's water bottle during a workout, and they had a weird sore throat last week. A few days later, you're the one feeling awful. That's EBV doing its thing. Once it enters your body, it starts multiplying in your throat and blood, especially in a type of white blood cell. Your body eventually fights it, but not before you get sick. Fun fact, over 90% of people get EBV by age 40, but not all get full-blown mono. Some don't even know they had it. How do you know if it's mono and not just a bad flu? Let's play detective. Start with fever and a sore throat so bad it hurts to swallow. Like eating chips feels like swallowing glass. Then your lymph nodes, those little bumps in your neck and under your arms, puff up like balloons. You're exhausted, not I stayed up too late tired, but I napped all day and still want to sleep tired. Some people get a rash, especially if they took amoxicillin for a sore throat, common mistake. Others feel pain in the upper left belly. Why? Because the spleen gets swollen. And here's a scary one, rarely. The spleen can burst if you get hit hard there, like during sports. So if your doctor says, don't play football for a month, take it seriously. Headache, loss of appetite, and night sweats are also common clues. If 3 or more of these match your story, mono might be the suspect. How do doctors catch this sneaky virus? First, they ask about your symptoms and check your throat and belly. But the real clue, a blood test. One common one is the monospot test. It checks for special antibodies your body makes to fight EBV. It's like a wanted poster your immune system puts up. Sometimes it's not accurate early on, so doctors may order a full EBV antibody blood panel. No antibiotics work because it's a virus, not bacteria. So treatment, rest, lots of fluids, and over-the-counter meds like ibuprofen for fever and pain. Imagine your body is rebuilding a damaged city. Rest gives it time. You can't rush it. Gargling salt water helps your sore throat. And no contact sports for weeks. Even if you feel better, your spleen might still be fragile. Most people get better in 2 to 4 weeks, though fatigue can last months. No magic pill, just patience and self-care. Can you avoid mono? Since EBV is everywhere, complete escape is hard, but you can lower your risk. Think of it like avoiding germs during flu season. Don't share drinks, utensils, or toothbrushes. That cute couple sharing a milkshake on Instagram, cute, but risky. Kissing, it's how it spreads most, so be mindful with new partners. No vaccine yet, so your best shield is good hygiene. Wash hands often, especially after being around sick people. Teach kids not to share bottles, parents. This one's for you. Once you've had mono, you're usually immune for life. Your body remembers the enemy. But here's the twist: EBV never fully leaves. It hides quietly in your body, like a spy on vacation. It might reactivate later, but usually without symptoms. So prevention isn't about perfection, it's about smart habits. Scientists are finally focusing more on EBV, not just as a cause of mono, but as a possible trigger for other serious conditions. Recent studies found strong links between EBV and multiple sclerosis, a disease affecting the brain and spine. It's like discovering the same hacker caused two different system crashes. Researchers are now working on an EBV vaccine. Imagine stopping mono and maybe even MS before they start. Other advances include faster, more accurate blood tests that can tell if EBV is active or just sleeping. There's also research into antiviral drugs that could shorten mono's course. Right now, none work well, but hope is growing. Some labs are even studying how EBV affects long-term fatigue, possibly connecting it to long COVID-like symptoms. So while mono still means rest and patience today, tomorrow might bring real treatments,